Hi everyone, this is just a quick video of the brief lecture that I provided on Thursday during week 1. I introduced you to the concept of advanced healing arts, and I asked you to make sure that you had downloaded the course outline, course syllabus, course schedule, and the student lab manual, which is also called the course pack, which has the questions that you will work on each week, which will guide your learning and studying. Make sure you've reviewed the assignments and test information provided on Blackboard. For example, what will you be tested on during your catheterization critique? So if you look over the information there, you know that you'll be tested on sterile technique, on organization and planning. That means like setting up your sterile field, how and when to open equipment, things like sterile gloving, and then the actual process of the catheterization itself. You will also be tested during our quizzes on your knowledge and memory of the information we're covering in this course. So I've provided some examples of the types of questions that you might see. Here's a basic knowledge question. The nurse is assessing the urine of a patient. Which of the following findings is of most concern? When you read the question, which finding is of most concern, that means that one is out of the ordinary. It is unlikely that you will get a question that will have everything out of the ordinary and you have to prioritize one. What it will be that some are normal and there'll be one that's abnormal. In this case, the abnormal finding is B, specific gravity of 1.000. You'll notice that I provided a hint where I said table 42.3, where you can find characteristics of normal and abnormal urine, and this is part of assessing. Let's look at another question. The nurse is preparing a patient with an indwelling catheter for discharge home. Which of the following should the nurse prioritize? When you hear the word prioritize or best or most, that typically means that there is more than one correct answer here. The nurse has to decide which one is the most important thing that the nurse must remember to teach this patient. So in this case, the answer is again B, to call the doctor if noticing signs of a palpable bladder. The reason that that's of concern is because that would mean that the patient is having some retention, which should never happen with an indwelling catheter. You can see below that this comes under planning. The nurse has been assigned a client with an indwelling catheter. Which of the following accurately describes a nursing intervention for this type of client? When you see accurately describes a nursing intervention, that usually gives a hint that some of the things provided are not completely accurate, but there will be one statement that is completely accurate from start to finish. This is a straight knowledge one, and so reviewing your text will give you that the correct answer is that gravity drainage is maintained, answer C. That actually was a question from semester 1 when you first learned about catheter care. Notice that I've given the word implementation in here. According to the Ontario Regulated Health Professions Act, is urinary catheter insertion a controlled act? Don't read anything more into the question than's there, and all this says is it a controlled act? And the answer is yes, and it is authorized to nursing. All the other answers are not completely correct. Please remember to review whether or not each of the procedures that you're doing throughout this semester are controlled acts or not. There are 4 controlled acts authorized to nursing, which means that we can initiate them. However, typically we need a medical order based on another piece of legislation, or it is something that, while it's within our authority to do, it is beyond our scope. So it's important to look at whether it's a controlled act or not. So if there's no study notes in this course, as you've noticed so far, I've just posted information and I've posted videos, but I haven't posted lectures. So how will you study in this course? This is some tips and hints I'd like to give you now. They're merely suggestions. You know yourself how you can study best. My first hint is that you should consider using nursing process. The textbook is organized in nursing process. Each of the chapters within the textbook is organized within nursing process. That is assessing, diagnosing, that is nursing diagnosing, planning, implementing, and evaluating. Let's look how that applies. How do I create my own lecture notes? So let's go to a starting point before we get into applying the ADPI. First step is look at your learning outcomes in your student lab manual and review briefly the anatomy and physiology. Next, examine the course concepts and locate that information in your textbook and review the stuff that I've posted on Blackboard for you. Notice there's a whole list of concepts there. Make notes in each concept, and the next few slides will give you some ideas around how to make those notes. And then finally work through the student lab manual questions. So, the list of concepts. I suggest that you use each of these concepts as a heading to take notes and to make notes under. For example, using assess in the ADPI, which is assess, plan, implement, and evaluate, what in your textbook comes under assessment? So there's headings, and there's a physical assessment, there's a urine assessment, and then there's a pre-procedure assessment in each of the skills pieces. Then within each of these areas, there are further subcategories there. Or you can pretend like I have created a PowerPoint lecture for you, and you use each heading, each concept as a heading, making notes on the side for yourself. Remember, they don't have to be written out in full sentences, but brief notes with page numbers and particular tables to come back to is a great way to help you familiarize yourself with your textbook, where information is located, and to tie in key pieces of information. Another way you can do it is just to look at the textbook where it starts with assessing and then make bulleted lists for yourself. Use the headings that they've provided, such as nursing history, to write some notes for yourself under nursing history. Here's another example under plan. In the textbook under plan, it says prevent risks, and then there's managing devices. If you have any questions, I welcome you to come and see me each week in our classroom. Bring your study plan with you. Have as much information as you can in that study plan. Again, it's not about writing out the whole textbook again, but it's about organizing your notes. See you next week. Good luck.